Dr. Hinchcliff, what are the common treatment approaches for endometrial cancer?
So, endometrial cancer, when I think about any cancer treatment, there are sort of three big buckets of treatment. There's surgical management, radiation, and then chemotherapy or some form of systemic treatment, meaning treatment that goes into the vessels that's going to spread throughout your body. Um, and endometrial cancer can be treated by actually all three of those or combinations of the three of those, depending on that cancer stage and depending on that cancer subtype, right? And so, what I would say is kind of for endometrial cancer that is confined to the uterus, generally speaking, surgery is your upfront first line of defense. And then once you understand after taking that uterus out what the risk level is, your doctor may recommend chemotherapy after, they may recommend radiation after, and that sort of is dependent on what they see under the microscope. But for cancer that's thought to be confined to the uterus, it's surgery and then maybe additional treatment afterwards. For endometrial cancer that has spread outside the uterus already to the lymph nodes, elsewhere in the abdomen, or more distant, then we start to think about that systemic therapy. And that can include chemotherapy, which works by killing rapidly dividing cells, as well as what I mentioned before, which is immunotherapy. Immunotherapy is medicine that kind of takes your own immune system and tries to rev up your immune system to better fight the cancer, because the immune system is predisposed to recognizing abnormal things, and cancer is inherently abnormal, but cancer is smart and develops ways to cloak itself. So the immunotherapy kind of takes that cloak off and revs up the immune system to try and get an immune response.